Assalamualaikum and good afternoon, everyone. So before we start, so everyone, have you had your lunch already?
Yes.
That's good to hear. All right, we continue our program for today. We are very delighted to have our this afternoon speaker, distinguished speaker, Associate Professor Dr. Nasrin Agha Mohammadi. So before she starts, I would like to read her very brief biography. So, Associate Professor Dr. Nasrin from Department of Social and Preventive Medicine, Faculty of Medicine, University of Malaya. Her core expertise is in environmental health engineering, climate change adaptation, urban heat island phenomenon, and health impact. She has published several books, book chapters, and 58 papers on public health, air pollution, environmental pollution, modeling, and review papers with H index of 22. I think this is a WAS, Web of Science. She's also an associate editor for the International Journal of Sustainability, Cities and Society, Elsevier, and also a guest editor for several journals. Without further ado, I would like to invite Associate Professor Dr. Nasrin. The floor is yours.
Thank you very much, Prof. Hafida, for your kind introduction. I'm so delighted to be here and share my experience with you and other colleagues and students. Just a disclaimer, I'm not a psychiatrist, I'm not a psychologist, I'm just trying to share what we are going through. Allow me to share the screen, please. Assalamu alaikum and salam sejatro, and a very good afternoon to all attendants who are, I think, perhaps, I presume they are postgraduate students in the University of Malaya. Today I'm going to share this session of the mental well-being session, and meanwhile also I would like to appreciate and acknowledge my doctorate in public health students who had contributed to preparing this slide, and also Associate Professor Dr. Nigdaliana Farid. I think what am I going to cover today's session? I will first talk about mental health. Then I will briefly touch on the stress and its management. And last but not least, we will go through some simple mental health intervention, which are evidence-based and hopefully can help you during this session to a little bit ventilate and feel relaxation. And then perhaps you can practice in your daily lifestyle. Yeah. First, what I'm going to talk is a little bit touch on the mental health literacy at all. What does it mean? Mental health is a state of well-being which that individual realize her or his own ability, and they can cope with the normal stress of life, can work productively and fruitfully, and it's able to make contribution to his own community. So I think what I'm going to here to emphasize is individual realize his or own ability. In that text, they are aware of the person who is aware about their ability and their strengths. So, for example, a candidate who has working on a topic or the research, perhaps you really need to be focused on what do you understand about your methodology, your research question, and how you want to conduct your project, right? And then the other keywords is can cope with the normal stress of life. Of course, students normally face with the problem and challenges, especially during the, let's say, exam time, or perhaps sometimes to meeting the deadline on, or some teamworks and working with others, delivering the assignment, right? So you need to be productive, and when you don't have in a state of good state of mind, so perhaps this has a direct impact to productivity, and this is where perhaps contribute to the mental health, stress, anxiety, and you may not be able to perform well and meet the deadline, right? So perhaps talking about good mental health, talking about that maybe is about feeling good about yourself, self-respect, realistic, able to accept failure, and also not excessively emotional, able to satisfy and most aspect of the life, feel good about yourself, right? About people also, feeling sense of belonging, understand and respect differences, and able to love and be loved, to cultivate a kind of sustainable relationship, and also able to handle the life challenges in terms of capability setting, a realistic goal confident, and planning the future, able to make a decision, able to solve problem, and adjust it if necessary. Talking about the mental health problems, perhaps normally occur when someone thoughts or feeling or troubling them and interfere with the day-to-day activities and relationship. For example, depression, generalized anxiety disorder, panic disorder, obsessive compulsive disorder, or post-traumatic stress disorder. Normally, this is happen after disaster or some incident happening. I think COVID this time mainly we are involved with that. Talking about the mental illness, medically is a diagnosable illness, and the result is significant impairment in the individual function and ability, and cognitive or rational, and also require treatment. So treatment is a key word, I think, here. We should understand they are treatable, so it's not a matter of, oh, okay, the person has mental health, so must be ashamed, or oh, okay, it's something so simple. If you look at the statistic, we are in academia, so I need to show you some academic study. In Malaysia, the prevalence of mental health problem among individuals above 18, measured from 1995, and also you can see by 2015, it's approximately threefold. And if you extrapolate this, perhaps by 2021, we can see even it is increased more. So this is something we have to think among population. We are facing with this matter. Also, this study here study conducted among university students during the lockdown of COVID-19. About 983 respondents, they have responses. 20% of them experience minimum to moderate anxiety, 7% severe anxiety, and 3% most extreme anxiety. So this really shows there are evidence based on studies shows that this is increasing, especially at this time. And among them, perhaps I can tell female gender, normally age above 19 to 25 years old, university level education, and they are all of them feel this stress mainly because of loneliness and also because of anxiety they have attending to the online courses, uncertainty about the future, and economical and career issues. So talking about the mental health literacy, this concept since 1995 come out, and it is defined as understanding how to obtain, maintain positive mental health, understanding mental health disorders or their treatments, decreasing stigma related to the mental health disorder, and also enhancing help-seeking efficacy, knowing when or where to seek help, and developing competences to design to improve the mental health problem. So this is, I can tell in these slides, mental health literacy is important. Why it is important? Because the individual who are have understanding of mental health, they are mental health literate, so they can identify the sign of the mental health illness much earlier, so you don't need to leave it in the very critical stage. And then since you have knowledge of that, so perhaps you can diagnose it faster and then immediately get the help, suitable help from the experts. And definitely there would be no stigma towards a mental health illness, and by then you can solve the problem and understand this issue and just seek for their help. So here I'm going to a little bit emphasize on the differences between different terms of the mental health. First, we talk about the depression. Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest, also called major depressive disorder or clinical depression. Is affected how you feel, how you think and behave, and can lead to a variety of emotional and physical problems, right? So it is treatable. So there is no problem. It is easily can be treated. And and the sign of depression mainly is a loss of interest in daily activities, loss of focuses in work or a school job, problem having a good sleep, changing appetite, increasing or decreasing appetite. Also, it has impact on the body weight, and feeling lethargic very fast, can be tired, outrageous guilt, broken-hearted, and also being very outrageous of the sense of the inferiority. So another term after depression, we do have anxiety. Anxiety is emotional characteristic by feeling of the tension, worry, thoughts, and physical changes like increased blood pressure. People with the anxiety disorder usually are carrying the intrusive thoughts or concerns. They may avoid certain situations because of being too worried. For example, a person who has social anxiety disorder, normally they are really extremely scared to be judged by others, and then very self-conscious in everyday social life and situation. Try to not meeting new people, and if this feeling take a bit longer time, maybe this way at least 6 months, so this feeling really is going to be a very serious social anxiety disorder, right? So again, we have to avoid being too much worried, and this is where you can seek for the help from the experts. The sign of anxiety is easily surprised, unable to calm down, difficult to focus, always have a feeling of the restlessness, difficult to get good night's sleep, easily tired and lack of energy, and always thinking of scary things, right? Some feel perhaps will experience a physical signs such as a cold hand, feet numbness, palpitation, breathlessness, dry mouth, dizziness, and fast breathing. Right? If you look at this slide, this slide shows a celebrity. Anybody can experience anxiety attack, and it could be even celebrities, famous people. Here she has experiencing of having anxiety attack, where she felt always her hands is trembling. Her her chest felt like going to be explode, and difficulty of breathing, stomach cramp, and difficulty in the focus, right? So those who are sitting, for example, for the exam, they can have this experience panic attack, and they should know how to control this feeling. Yeah? For example, the best solution is first to have a deep breathing, right? So normally the students who have this problem, they have the time when they have exam, they have overlapping of the assignment time, and nearby the proposal defense, candidature defense, viva. So this is where we really need to take care of our mental well-being and be concerned about our own body, right? Here in this slide, I'm trying to show you perhaps where you can get the professional helps here in Malaysia. And there are various places where you can seek for the help, or you prefer to go to the outside of university. You can help from the hospital, health clinic, community mental health center. They are all under the Ministry of Health. And also beside of that, there are NGOs like MMHA or MIASA who are really willing to help. And also in University of Malaya, you can just walk here in University Malaya Medical Center in a psychology medicine clinic to seek for their help, right? This is a NGO I'm talking about. This is the Mental Health Awareness Support Association, which is the Karimesa, as a founder of the pension for the other one is a Mental Health Association, the Mind Hub, and the other one is the Mind Kami, which is making mental health better Malaysia, especially for the young and adolescents, and then Relate Malaysia, which is public awareness of this astigmatism and also mental illnesses. In University of Malaya, we do have this. If you look at this link, HEP, which you can have counseling is providing by the psychology management and counseling unit. You can browse this and you just can go and discuss with them. Now, what happened in your individual department where you seek for help? For example, you feel, okay, now it's too soon, or it's not that serious, but you need to talk to someone, right? I'm suggesting the first and best person, perhaps academic advisor, your supervisor. If you are not really comfortable, then there would be course coordinator or program coordinator, postgraduate coordinator, or the postgraduate assistant coordinators who are willing to help, and perhaps you can go through and ask them and seek advice. Sometimes you have overlapping of the assignment. Sometimes you need to change date, or sometimes you need extension, or sometimes you really need your you are in a status which you need to inform. And then just what I want to tell you here, please don't keep quiet. Don't leave it for the last minutes. I had experience of students I'm from Faculty of Medicine, and most of our students are themselves, they are doctors, they are very well aware about this, but they leave it for the last minutes when everything, the deadline finished. We can't help. But if you have this problem and talk about it, first of all, you can solve the problem. Secondly, we can help you to how to ease the situation you have. So I think you shouldn't be silent about this at all. So what prevents someone from getting help? Of course, lack of knowledge regarding mental health, being ashamed, or you scared people judge you in terms of a stigma, and also feel like no one can help. Is my problem. I can't share, and even I share. Who wants to help me? Yeah, and other things is also you don't know who to talk. Who do you share with? So this is very important to really emphasize on that. And the last topic of mental health I want to talk about it is stigma and mental health. So This is a wrong perception. Individual with a mental health problem are labeled as crazy. We don't have such things, because actually, remember, this problem related to the mental health and can be treated. At, it is not only with the medication, also it could be based on evidence-based intervention, or such activity like mindfulness, cognitive behavior therapy, like yoga, exercise, some kind of a massage, right? So this is what I'm saying and talking about the evidence-based intervention. So this is very important, and we should then think about it and reduce the stigma. How to overcome this obstacle? Of course, get the right information about the mental health. Mental illnesses is just like any other illness that requires help, and believe there is someone always there to help you. Coming to this, before we proceed for the next part, I think what I'm going to note here for the how to care for your mental health. Share your feeling with someone who you can trust. Yeah, avoid kind of substances usage like illicit drugs or alcohol, right? And then perhaps do some physical activities as much as possible. Do exercise or practice active transport. Active transport means walking, right? Just 30 minutes per day, walk around the area, let the body move. Then I'll talk about it later in the next few minutes, how this is helping to you to has impact there. Body activity has impact on your physiological part of your body. Yeah. And also, I know this is a lockdown time, or perhaps still people not really feeling comfortable to communicate with each other, but try to stay connected with your family, friends. Avoid any social isolation. Yeah, even you can go, still you can use the Zoom, you can use the video call. Make sure you keep communicating with the society. Very important part, especially those who are now classes is online, you're at home. Eating healthy, you see it, you don't eat healthy, then consumption of high sugar and sweet, or using of the fast food, it really has impact on the mental health. And manage your time. Time management, I think, is very important aspect in mental health, especially at your stage where you need to deliver, I don't know, revision of your papers, submission of your reports, progress reports, registration. So this is where you really need to have a proper timetable, yeah? And do activities that you like the most. Okay. Now we reach to the point. I talk about a little bit, discuss about stress and anxiety and depression, which is a mental health issues. Now we come to the point we need to talk about management. Stress management. This has been reported as a top 3 sources of stress among university students. And of course, due to all this activity you have, you feel anxiety, depression. So you really need to understand how to manage your stress. I understand most of you are the postgraduate students, you are well educated, but then again, I feel I need to bring this topic out, especially at this time of a COVID situation where all classes are carried out online, and perhaps you have to do your research maybe away from the campus, or you need to collect data and information online. So that's why this is where you feel really stressed out, and definitely you need to follow these 5 steps. First of all is the loneliness and relationship difficulties. We are socially isolated here, right? And we hardly see our friends, family members, and even happen in between families. Some family are not really keen to mix because of issues of the spread of COVID. So there is a lack of connection. So stress is building up, and some couples maybe have some family issues, family relationship difficulties, etc. The second one is the struggling to save money. Perhaps some of you are doing extra works to pay your tuition fee, and this may affect your study, right? The third point is unable to balance between study and family. A study at home is not very easy, right? Working from home is not also busy. Some of you are maybe female, you have to study from home, work from home, do the housework, and I'm sure there are also male who are really contributing a lot to the taking care of the children and cooking, I don't know, doing the homework, and this is all again issues which you again have triggered the stress. The fourth point is worrying about exam or proposal defense, candidature defense, seminars, right? So this is what's happening. You feel overthinking. Am I passing? Do I have problem? Is my supervisor allow me to submit? So this is, did my report goes correctly? Did submission went through? You know, a little bit here, a little bit there. Then this is again cause kind of stress, and that at the end. Yes, it is very important to complete the assignment, or I don't know, progress report or whatever you're supposed to complete before the deadline. I do have a student, perhaps they're here, and they are very interested to do things after the deadline. So imagine, what am I sharing here for you? Behind of the scene, your supervisor, your lecturer also, they are human too, right? So on top of all, you have problem, they have problems, so the relationship became very stressful. It is very important to really manage this, and the management of the stress, I think I'm going to really share on that, the reaction to the stress circumstances when you feel stressed, right? React differently. People have different personality with different reaction. One of them is behavioral. This could involve avoiding or escaping from the situation and turning to alcohol or drugs or other high-risk behavior, even using some pills which is not really properly prescribed. And definitely this has impact to the appetite, and this again will causes you have lack of or inability to concentrate, right? Then we do have a physical concern. You may experience it, and increase heart rate, sweating, shaking, headache, butterfly, or over breathing. And then psychological also would be stress, can lead to the fear, panic, feeling that something is really going to happen badly, right? So now, how to deal with the stress now? You are facing with that problem, how to deal with that, how to manage that? First of all, I think exercise is important, right? Exercise extremely important. Stress to some degree is normal part of the life, and it is only when the amount we are exercising exceeds our capacity or our resources to manage it run to difficulty and find ourselves in a vicious cycle of stress, right? Successful coping mechanism differ for everyone, but if stress is beginning to affect your mental well-being, you need to really find a solution. And exercise is not something you need to go to the gym. No, you can simply do some activities to get your heart racing, for example, by going to brisk walk, or I don't know, bike riding, walking around the neighborhood, right? Exercise by itself can hugely beneficial for your mind as well as the body, and regular exercise itself will release endorphins. This is where you feel good, yeah. This is the feel good hormones, endorphin, right? And that can help to reduce tension and allow the mind to focus on something which is no need to be so much worried about this, right? So there are a lots of research shows the exercise really helps to improve the body activity. And perhaps at this time, we do have in UM the Pusatsukan with the gym facilities, but maybe at this time it's closed, so you can use some kind of Zumba classes by Zoom session or online. There are yoga, yeah. So there are also lots of activities in online ongoing which you can attend. And I think moving is very important, right? So this is really having a I don't know, just dancing, just 30 minutes dancing, put music and dance. So that you need to move, and the movement really helps. Another things is mindfulness. Mindfulness is a relaxation technique, is becoming an increasing popular coping mechanism for those tackling stress and anxiety, normally used by the clinician to improve patient physical and mental health. It can significantly lower your stress level. It most often practiced through deep breathing. So that's why breathing is very important. And also it goes by the guided meditation. Mindfulness is also accessible by through kind of application in a smartphone you have, and there are some kind of mindfulness app, Calm and Headspace. So I think breathing itself is a practice. Perhaps you yourself can really doing it, and it's really, rather than ruminating over the problem or catastrophizing it, you can just simply have an attempt to focus on your mind and make your mind relaxed and positive, and start to do it. We are going to do a practice now based on this I'm showing to you. You can just follow me step by step and see how much you can, perhaps since morning now, what time is it now? About 3, yeah? So perhaps you had accumulated some stress since morning. What I'm saying, you can just follow my step and just be with me and see how do you feel. You sit in a very normally at home. If you want to do it, you create your time and a space. Make sure you have a specific timing for your mindfulness meditation. Then set a timer or alarm. Normally you can start from 5 to then 5, even at very beginning, 5 minutes. Even you feel you may find it too long, but please, minimum is 5 minutes. You have to bear on that, and then time to time you can increase it between 15 to 40 minutes. Then you find a very comfortable position. You can sit with the cross leg on the floor, or you can sit on a chair and also flatten on your feet on the ground. Make sure your feet is grounded, and then make sure your position is correct. For example, when you sit straight, yeah. Your hands comfortably positioned. Perhaps you can put on your knees. Keep your neck long, and also chin tilted slightly downwards, right? Then your tongue can be rest on your roof of mouth, and you can close your eyes slowly, yeah. And then you can, in this time, you can slowly start to breathe. Take a deep breath, yeah. Let your body establish and feel more comfortable. Then make sure you focus on your body part and breathing zone, and feel your breathing. Try doing focus on your breathing. Think about your breathing. Use your nostrils and breathe from the nose. Breathe in and then breathe out from the mouth. Yeah. Maintain your attention on your breathing. Inhale and then exhale. Focus on inhaling. When you inhale, perhaps you can count with your nose like 1, 2, 3, and exhale from mouth with 6 numbers. 1, 2, 3, 4, 5, 6. Yeah. So by 3 in with the nostril and by mouth, exhale 6 numbers. So this helps your lung totally expanded. You may repeat this one about like 6 to 7 times, and don't worry, be kind to yourself. And if in a sense suddenly you're distracted with other thoughts, again try to back with the closed eyes and again think about it and do it. This is where you can really feel comfortable. And after you finish the practice, you can a little bit take your time, then you feel more comfortable, you can open your eyes. I hope this really helps. This is really helpful. If you have time, you can do it 3 times per day, or at least 2 times per day. When you morning you wake up, before you're sleeping, it really helps for those who have a sleeping problem. So this really helps to make your body calm and settle before you go to bed, right? And there are many methods of breathing. The other one is you can put your finger cross on your belly button, and then again, but while you are laying down on a bed, and do same practice, right? So I think breathing is where you get enough oxygen in your body, let your mind be relaxed. And since you are focusing on your breathing itself, you are trying to avoid any distraction, and this really help you to a little bit come down from the stress and activity every day you have it. You need some rest from that section. Another very important is talking to someone. Yeah, so isolation can have extremely negative impact on your happiness. Accepting that you may need to someone to help, first step, right? To talk to the person. This can be a friend, can be family members, whoever you think is the best person you can talk to. Yeah, because you need to socialize at least once in a week. Meet a friend at least once a week. This really helps the stress level and then improve your mood. And it's kind of itself could be kind of therapy and counseling section. Visit your friend, tell them about your problems and what problem you are facing with, and tell them about what good things you are doing. It's not all about negative concern. Sometimes you have to talk about what other good things you can do, and let them help you from the to gain some perspective from them. Yeah, so I think that's very important also. Another things, students can also make appointments with the well-being services, and I'm sure, as I said, also in our institution we do have this section, so you can make appointment university councils to support the group, right? Okay, time management. Time management, it's very important because people normally became so stressful when they are free, they are running out of the time and they need to complete something. Yeah, so this is very simple management and make you very relaxed and focused. If you have a very proper schedule or timetable, break your task down and put them, prioritize which one is urgent, which one is non-urgent. So once you really characterize what you are doing, what is the most important, what's the urgent job you have doing, then definitely that really helps. Other than that, you compile it all together and say, okay, later, I'm doing later. All this later, it's accumulate and really distract your mind in your unintentionally always you're thinking about, oh my God, I have to reply this email, I have to deliver this, I have to do this. And this keep moving to your mind while you don't even know where it comes from, all this stress, right? Getting enough sleep. I'm sure, especially at this time when we are working from home, we are studying from home, mainly, definitely this is a big interaction and a distraction to our sleeping patterns, because we really don't know when to sleep, when wake up. So especially among the students, that's very, yeah. So maintain the sleeping routine. Make sure you sleep in exactly the time you're sleeping every night must be fixed, right? And the time you're waking up also, so must be sleeping all at the same time, wake up at the same time. Do everything you can to relax yourself before going to bed. So just now I was mentioning about you, if you feel really stressed, you want to sleep, so make sure you have some breathing practice, take a bath, wind down. I believe personally, I couldn't find I didn't have time to find a scientific paper, but definitely all all of us mainly are watching. Always we have this our handphone with us and working from handphone, talking to friends with a handphone. I don't know, checking email from handphone. So these lights for long term make our mind very fresh and very awake. So that is another impact. I think really has problem to cope with the sleeping time on time, right? Okay, come to the very interesting topic for me, which is food to feel the fabulous. You have our permission to eat your feelings. Remember this movies of the Inside Out. So we do have a different feeling, and in terms of anger, happiness, disgust, sad, and being scared, right? So if you look at that, we do have this menu here with you. Perhaps we need to include good food in our diet. For example, talking about breakfast, to have some oatmeal with honey and cinnamon, snacks, some nuts, peanuts, I don't know, pistachio, walnuts, some seeds, some of the seeds like sesame seed, which we always having in Malaysia, easily accessible, or sunflower or pumpkin seeds. And then for lunch, we do have some green vegetables, curry leaf, yeah, omega-3 food containing a lot of fish. And coming to the sweets or snacks, again, fruits and sweeties, I think we should avoid artificial sugars, mainly go for bananas, blueberries, yogurt, dark chocolate. And drinks, avoid any sweet drinks, mainly go for the green tea, coconut water, butter, and warm milk, yeah? So this is what we are eating for breakfast, right? Nasi lemak, roti canai, mihu, lontong, yeah. So they are mainly it's good, but if you look at roti canai itself, it's a very high carb, right, and oily, right? So we have to really make sure to have enough serotonin, which is this is serotonin. Serotonin is a very important compound in a rich carbohydrate diet. When you eat the carbohydrate, it results in a raise of the insulin level in your body, yeah? And it is ushered to the amino acid or tryptophan into the brain, right? Tryptophan is the precursor to serotonin that helps to stabilize our mood, right? So one or half of the ounces of the carbohydrate food means about quarter of the cups, right? Cups of oatmeal, for example, for breakfast, or having sourdough bread, they are significantly boost the brain levels of the serotonin. So that's very healthy as carbohydrate. Perhaps for breakfast you can use it, and also the whole grain and low glycemic really is good for the body, which you can find in barley, for example, in oats, I don't know, in buckwheat, or some of the vegetables even. So even we can find it in yam and sweet potato. If you look at here, like almonds, pistachio, and walnut, here the pistachio contains high amount of potassium, and then also has antioxidant, and then walnut has alpha-linolic acid, and and then vitamin E and selenium. Selenium, this is all the vitamin and supplements during this COVID time. You can hear they're all consuming vitamin E and selenium, B12, or I don't know, any kind of B complex really helps to boost energy. They are very good for the immunity system and make more resilience during the bouts of stress. And just you need a handful of these nuts per day, and also almond has high amount of magnesium, vitamin E, and again flavonoid or B vitamins, right? There are again because again, we are in academia, I'm sharing with you this paper for BMC Medicine, which is a systematic review of 29 publications, did the meta-analysis, and they found it the dietary recommendation to increase nuts consumption to reduce chronic disease risk and mortality. So that's very important to consume. Also different seeds like sunflower seeds or sesame seeds, they have high amount of magnesium, you can see here. So we don't really need to buy multivitamin if we do have a proper good food diet. If you look at the again here at the pumpkin seeds carries a tryptophan, also is high amount of it, and you can find it in the free range organic eggs, for example, which again is very good for the brain and serotonin. There are a sample of the seeds snacks, which you can choose it as a snacks eat. I don't know, seed bread, crackers, or any biscuits, right? Very interesting in Asian food, we do have, for example, the vegetable curries. They are very good. They carry high amount of the capsaicin, which is a molecule of in a chili pepper, and it releases endorphin, which has a calming effect. Then turmeric, again, curcumin. This is the main ingredient in turmeric. This can boost the brain neurotransmitters, serotonin, and also dopamine. Then again, this has a very good impact in our mind and brain. Also, curcumin, to other paper number 3 shows, a study shows the in 60 depressed patients was very effective as they're using Prozac, right, for the symptom and depression. So this really helped them to boost their energy and also help them to have better mental health. There are different type of sample of greeneries you can eat with a good chlorophyll in your body. Kale, spinach, yeah, you can see vegetables like watercress, bok choy, yeah, and then rapini and the Romani lettuce. You can make a nice food with that. You can see different type of food here, which really can help you for the lunch or dinner. And sometimes for a very light dinner, you can use the broccoli, rapini, kales, yeah. Looking at these studies, we talk about folate helps. Folate come from the green vegetables, come from the all these vegetables are to show you. It helps the body to produce mood regulating neurotransmitters, and rich in folate, it produce dopamine and serotonin, and also contains high amount of magnesium, which is relieves the tension, headaches, and fatigue, compounding and affect stress. So talking about the omega-3, right? We don't need to use the pills, right? We do have salmon, we have the anchovies, we do have a lot of different type of fish in Malaysia, which they have a high amount of the DHA and EPA, which is considered as an omega-3, right? So the result of the study shows a dramatic of 20% reduction in anxiety among medical students taking omega-3, right? So the omega-3 you can see here. So it could be, omega-3 will be very helpful for you. If you can't, I mean, of course, if you can't always every day, I'm not myself a person who is interested in a fish, right? So but this is how we can control of the, yeah, especially anxiety. Fruits, berries, yeah, like blueberries, yeah. So this antioxidant, very good antioxidant. We do have like dragon fruits, yeah. It's high amount of antioxidants. Not necessarily we need to go for the expensive fruits. I mean, I know in Malaysia fruits and vegetables is not that cheap. I understand that, but they are a good food, right? We don't talk about the finance part, right? So berries and antioxidants have high amount of the dopamine, which really helps for the memory function and mood, yeah. And then banana is something easily to find, has high amount of different of the vitamin like B6, and then also got a lot of amino acids, tryptophan, to prevent and preserve memory and boost mood, and magnesium to precursor for the serotonin, and also really helps for the cardiovascular diseases or digestive health, and it's considered as one of the very good antioxidant. Coming to the snack time, yeah, of course, having it's very secret to improving your mental health in your gut. If you have some kind of depression, anxiety, to get a very good like a kind of berries, right? So I'm going to move, and I'm so interested in this slide because I'm a chocolate lover, and fortunately, chocolate really in recent study shows actually it's not very new, it's not in 2013, shows chocolate, especially dark chocolate, is anti-anxiety because of the anandamide they have. So this really help to really reduce the what they call it, the depression, and it has a high amount of antioxidant. The studies shows in psychopharmacology, drinking antioxidant of the rich chocolate, actually it's a dark chocolate. Dark chocolate means more than 80%, 75% chocolate. It really helps to make you calmer. So really, so many as a study are encouraging to take 1 cup of chocolate, dark chocolate, or a small piece of the dark chocolate per day consistently, and really helps in the cardiovascular diseases. The drink, it is very important. Avoid any sweet drink, avoid any sugar and sweet, especially at this time, because sugar really increases the stress level. And green tea, warm milk, water, and this valerie tea and coconut water. It is very interesting. The study shows for dehydration, warm milk really helps more than the water for take care of body and dehydrating the body. So if your body wants to be hydrated, a cup of milk is more effective comparing with the water. So that's, you can, I think, something we can think about it and consider. We have a quote here in terms of the food, which Mahatma Gandhi mentioned: I eat to live, to serve, and also if it is so happens to enjoy, but I do not eat for the sake of eating. And Socrates says, thou should eat to live, not live to eat. And Mallory mentioned, one must eat to live and not live to eat. And Benjamin Franklin says, eat to live and not live to eat. So this is our after lunch. That's why I think the Prof. Rafida earlier should have eaten your lunch, because we don't want to feel hungry. Yeah. So, but the good food really is important for the mental health. And we talk about inside out, right? We need to take care of first our body and the appearance and the good food. Then we will have a different emotion. Okay, we are coming to this session, which I think it's very important, because if you don't have a time, or gym is closed, or you don't want to spend lots of money on that, you can do some exercises at home where you are sitting at your desk. We go to have some exercise now, a little bit, to see what really is important. I think yoga is very good. Yoga, it's come from the Sanskrit words, they call it yogis, which means to join. And yoga is ancient art based on the harmonizing system and development of the body, mind, and spirit. And it is a system of exercise to attaining bodily or mental control and well-being. Continuous practice of yoga will bring emotional emotional stability and clarity of mind. So it is very important to really have some practices per day, even you, especially for us, we are sitting behind of the computer for so long. We even sometimes we lose the time and we don't know how long we sit here. Yeah, so that's very important. Here, perhaps you can pick up one of your lucky number and do one of those poses. I think I'm going to choose number 5 since I'm sitting here in a chair. So I'm putting my feet in a grounded. So turn back and look at the wall behind of you for a few seconds. Make sure you twist totally both hands. Come to the center and turn back and look at the other wall behind of you. Yeah, I'm sure you're tired now by talking me so long. And so we do have, I'm going to just introduce some poses to you because it is important, are very basic, but you can do it on your desk and feeling good. Lean your back, push up your back a bit lower back, and then this pose is really good to the side body tends to collapse, and when you hunch over the computer all the time is contributing to neck and shoulder discomfort. So that's really good if you can do it, but it's a bit complicated pose perhaps you need if you haven't done, or if you're first timers, to avoid this pose. But this is the easiest pose. Perhaps I'm going to do it now. You can do it with me. Feel free. Nobody's looking at you. You can look at me. It's okay, but nobody look at you. Please do that. That really helps. Lift your arm up overhead. Yeah, and stretch your finger wide and as if pointing the ceiling. Lean to your perhaps right. 2, 3 breathing. Make sure you keep breathing. Come back in middle. Go to the left. In center. This is very good side body because it tends to collapse when you hunch again your computer, when you have a bit like headache, or your spine a bit make you taller, so you feel more comfortable and fresh. The other pose is very good also when you are doing a lot of typing. You extend your arm and you just start to twist your arm inside out for 5 to 10 times, then outside in. Yeah, so this really helps to release your stress from the arms. Then use your hand, yeah, like this. Place hand on your desk or palm facing, and fingers towards down, yeah, like this, what I'm doing. Putting gentle pressure and then a bit pressure your wrist. Then you can turn it back like this. All you are doing at the same time, you have to keep breathing. Yeah, and the breathing is very important because again, when you're sitting in a desk or you're typing, you are really tensing your muscles. Yeah, and the fingers also, they're really, so this is the time you can really help to relax your body. This pose is very interesting also. They call it eagle pitch. You can put your arm left and right together like this. Sit straight and your place and your arms in 90 degrees. Cross the arm, look what I did over it, and then interlocking to place the arm together. Lift your elbow and stretch your finger upwards. Make sure that your hands exactly in front of your face. And then you can breathe like 3 to 5 breathing. I'm talking you guys breathing in, breathing out. Also, you can, if you're standing, you can also cross your feet or limbs. You can have a little bit bending posture and cross the leg as well. You can change your hand, right? Like this one. Now this one, right? You can, sometimes you can bring it up and then easier like this, right? So this also will release the tension of shoulder, upper back, and it really helps you to focus. And also this is very, very good for the preventive of the carpal tunnel syndrome. The other posture, which I think I can't do it, but you guys can do it, and that's my favorite pose, upward dog pose. This is very good to help your backbone and also stretch the chest, shoulder, abdomen, and also strengthening your wrist, arm, and spine. You feel fine. You will find the feeling of keeping the chest open, and definitely the chest must be open because you are always sitting on computer and typing. So this really helps and encourages the posture better. This pose also is my favorite pose, which is again sitting down degree. Sometimes you don't need to have a chair. You pretend you're sitting on a chair, and this really strengthens your hamstring, and at the same time really help for your shoulder, and also really help to your back, upper back, neck, yeah, and it really helps to your blood circulation. The other posture, which is now I can do it, is a chair pigeon pose. You can put your feet on top of each other, flex your feet. The feet is on top, flex it, and make your finger flex, and just you can tilt back again. Look at the behind wall. Change the leg. Flex the feet again and go back. Yeah, so this is also very helpful and useful for you to get. There are a few poses here. I think about 6 poses I share here for you. Perhaps you can practice when you have time. Another thing is progressive muscle relaxation, which is,
Hi, Prof.
yes, yes,
Alexander, raise your hand.
yes, yes, yeah. Sorry, I can't
Alexander.
see anybody. Alessandra.
Hi, Alexander. You raise your hand.
Do you want to ask a question?
Yeah. You are.
Okay, please proceed, Dr. Nasrin.
All right, sure. You can ask question at the end. If you can't hear me because I can't see anybody, I can't see the chat box too. So, okay. And this is, apart from the yoga, we said the other method is progressive muscle relaxation. They call it PMR, tensing and relaxing the muscle, which is very good for the head and feet. This is reducing the muscle tension, which is commonly associated with the stress and anxiety and fear. Calm the body and including relaxation responses opposite to body stress response. You can see there are some position here. Which you can, see just moving the leg up and down while you're sitting or while you are laying down in the floor, right? We can go to the step by step. Perhaps I can tell you can follow me. First, you need to close your eyes. Please follow me. Close your eyes. And then tighten the muscle in your forehead, mouth, and face. Take a deep breath in and hold it tension for a while. Slowly release it as you take long, slow breath out. Remember, don't hold your breath at any stage. Take few breaths, really concentrate on your breathing in energy and also breathing out the tension. Breathe in the energy, breathe out the tension. Throughout whatever sadness, whatever dark mind things in your mind, throw it out. Breathe light and energy in, breathe out the tension. Now, next focus on your neck and shoulder. Lift your shoulder, tighten the muscle in the neck, and take a deep breath in. Feel the tension as you hold that position. Hold for a few seconds and then slowly release while you breathe out. Now focus on your arms. Hold them out in front of you. Keep them slightly bent and clench your fist. Tighten those muscles very tight. Keep the tension as you slowly breathe in and then slowly release as you breathe out. Tension breathes in release, breathe out. You can feel the differences, the tense and relaxed muscle when it's tightened and when it's released, right? So how much the breathing can help you to improve that. Now, tighten the muscle in your stomach. Push your belly button in and tense the muscle that your stomach is pulled back towards the spine. Feel the tension and then slowly release it. Take a slow, deep breath and move to your leg. Push the balls of your feet to the floor and raise your heel. A little bit, pull your heel up. Tighten the muscle in your legs and feet as you slowly inhale, then slowly release the tension as you breathe out. Breathe in, breathe out. Yes, you can open your eyes and you can see working hard for something we don't care about, it's called stress. Working hard for something we love is called passion. So there is another method also, which they call it acupressure massage steps, which also alleviate the stress. You can use different kinds of application. And I think what we are going to practice now together, which again, a little bit release our tension. Step one, you can put, locate your hand points of the arm, 3 fingers, length up the forearm beginning and the wrist. You can see in step one. And then apply the firm amount of pressure and rotating the tip on top of for your 2 and 3 minutes. You can do for both hands. I'm doing left hand now. In step 2, you can pressure, right? This is a acupressure, yeah? So you can just put your next area located in a web area of forehand between the thumb, index finger, using opposite hand, thumbs and index finger, and applying firm pressure, right, like this, on bottom of side, both hands. You can do it. This can be happen for 2 to 3 minutes, yeah? Other one is you just, step 3, you can use in the area located approximately 2 fingers widest above the arm and make the chest around to rotate the area and apply pressure firm here, yeah? Step 4, it's to improve the energy elevation exhaustion, which normally we do shoulder, we go back, yeah? Apply firm pressure and pinching area halfway behind of your shoulder and the neck and perform motion about 2 minutes and 3 to each side. So each side 2 minutes. And I think this is the last pose, which you put your hand at the back, the final area located on fingers width below the base of the skulls, and apply firm pressure in this area by wrapping the finger around the back of the skulls and use the thumbs to apply pressure. Stimulate this area while taking deep breath and closing your eyes. That really help to release your stress. Hope you enjoyed the session, and thank you to be with me today. Stay resilient, learn to relax, help others, learn how to solve problems, get on with daily lives, connect with people, identify resource for help, and teach others. Thank you very much.
Thank you, Prof. Nasrin, for your excellent presentation today. I learned something new from your presentation. That's good. We have questions here from, maybe you want to look at the chat. It's quite long, from
Oh dear.
Oda Elna Wawi.
Yeah.
Elna,
Yeah, okay, I'll try to read this. Okay, I'll try to manage that.
Yeah.
Hoida, thank you. In the last 3 months, I have suffering like what? Oh, I'm sorry. Oh dear, I'm sorry. Okay. Okay. Yes. If you found out through the exercise, it's still because perhaps you are a bit away from the family, that's really makes sense. Definitely having we do have our husband, kids, family by us, and still we do have this problem. So definitely, I'm sure you are an international student. You need to really talk to someone, and of course, I'm not the expert, so you can go to UM Help, the link I just shared. Perhaps Dr. Professor can share with you guys later and get the help and consultancy. One thing, another things also you can go to. There are a lot of, if you don't want in you and in case, there are a lot of outside like they do. I personally not really agree. We jump to the conclusion and use the drugs or any medication prescribed. Like EFT is another method of energy therapy, which is very, very famous and very common. But I think you need to communicate with the counseling section. Please do that and don't be shy about it. Don't want to do that. And our services is free of charge. So I think that is very important.
All right, thank you.
Okay.
Nur Aini.
Nur Aini, I'm not really sure about your question because I'm not the expert. So imposter syndrome during the study, no, I'm not going to answer this. Please talk to the expert. So because I can't really, this is very sensitive. When talk about anxiety, when we talk about depression and stress, they are very different. Even this needs really experts. Even myself, I'm with Dr. Prof. Rafido, we're working on a heat island, right? So some of my study is looking at the heat itself, the temperature, the weather we do have here itself could be some kind of impact. So it's very sensitive topic. Sorry, I can't answer your question right here. Yes, somebody here says, people always advise remove toxic people that contribute to the tension. Is there any better than... no, this is toxic. People are toxic, you need to remove them. Maybe the person is good, not necessarily that person is a bad person, but it's toxic to you. Maybe it's not toxic to me. So I think that's very important to avoid unnecessary situation or matters which really cause your stress more. So yeah, I think we can't fix the people, and we don't have time for that. And I think mental health is very important. So if you want to keep the relationship, again, you need to go for counseling session. Yeah.
When the toxic people are from among the family, so yeah, I think to get advice from the counselor.
Yeah. Even I'm not in a position to tell you, but I was reading a scientific paper who even mentioning even in family members you need to cut. But this is not our position to tell you what to do. This is where you need to really go and talk to the counseling session. Anything else? So
no, I think that's the last question. Anyone to ask question before we end this session? No, but I think it's a good presentation from Prof. Nasrin, because there are students and also me myself as a supervisor or as a lecturer, we are human being.
Yeah.
We cannot avoid to have stress, anxiety on certain occasion. But I know that now breathing is important, right? Breathing is important, and for students who in future they will they have a viva presentation, very important presentation. So as you said, that may be a very quick way of controlling the panic attack is to breathe in and breathe out. Just take for a moment, like 1 minute or 2 minutes to do that. Yeah. Okay.
Yeah, that's a saying. When you are even angry, you get angry. If you're standing, you sit. If you are sitting, stand up. Change the position and breathe deeply. Then that really helps to your brain to stimulate and really give you a time to a little bit change the mood.
Some people that when they are stressed or they feel stressed or kind of depression, I see that they like to sleep, just
Yeah.
go for a sleep, and for 1 hour, 2 hours, that will be fine, or just like 20 minutes, 30 minutes, not for the whole day.
Not the whole day. See, actually, the sleeping in midday is not really recommended, especially, but especially long time is not recommended at all because it causes some kind of heart attack or some heart disease. But the thing is, it's like our computer get problem. We start and restart the computer. We maybe need to have a short nap, but I don't think so. The long sleep is very advisable. But again, it's not my expertise, so I'm not going to really touch on that. Somebody asked some question here. I meet someone who is a stress. Okay.
Someone raised their hand. HVA
I think Miss
18003.
Dana Balan, is it? Dana Balan.
Dana Balan. Okay. Dana Balan, can you proceed?
Yes, Prof. Sorry, Prof. Last question. I think the session is about to finish, and only now it pop up in my brain. I just want to probably I just want to ask you about this scenario where this often happens to me as well, whereby for me personally, I don't feel it's a stress. I mean, I don't feel myself in a stress situation, but due to the stress, I sometimes I take it in my case. I do have gastric or some other medical problem. So when we go and see the doctor said, okay, you check here and all okay. I think you are stressed. I told the doctor, I am not stressed. I'm on holiday. I'm doing my studies. No, you are stressed. Your body are stressed. You may not feel stressed. It's a side of, it's the way your body is showing. If that's the case, what do we need to do in order for us to overcome when we do not know that we are in stress? Thank you.
Yeah, very good. I think point. See, if we have a healthy lifestyle, means eating good food, having a regular exercise, right? I'm not saying 100% you are being away from any sicknesses. The disease is there, right? But what we can do, the basic is to keep the lifestyle in a standard. You have a basic lifestyle, meaning that overtime table, stress management, exercise, good sleeping time, professional job. So this is what we need. We have to check whether do we have all. Am I doing exercise at least 30 minutes per day or not? Exercise solve a lot of problems. Okay, coming here, my personal experience. I had two very serious health issue last year, very serious, and I have to do both surgery at the same time. But it comes with the COVID, right? So what I did, I again revise my lifestyle, look at my food intake, look at my exercise, and of course a lot of breathing practice. I go for a course just for breathing practice online because it was a COVID trial, and that really helped me to remove all medication, avoid to do the surgery, and I'm stable. So this is my personal experience within the last 1 year. I mean, the starting of the COVID until now, I'm supposed to do the heart surgery. I'm supposed to do the removal of my thyroid. I stop everything and I'm not using any medication. So what I'm trying to do is not miracle. It doesn't mean, no, don't do it, go do that. But what I'm trying to tell you, you have to have a basic lifestyle and make sure you are doing exercise, you are eating good food, you are really doing everything. But by any, and when you talk about gastritis, you want it, you don't want it, you are stressed, you are a student, you are postgraduate student. Definitely, even you don't understand, you will be stressed. And this is really big. And our body is very sensitive. We really don't realize it when it happens. But I think that's what you can keep your lifestyle style in a standard level, at least basic of a healthy lifestyle you need to watch. The rest, yes, we need to go to the treatment, etc. Yeah. Yeah, one question I think was here.
Yes, Atika, I think she said that if we know someone is stressed, how can we help?
Africa, there is two ways. One, people sometimes they don't accept. Yeah, so we need to find a way, or perhaps you need to go to talk a counselor to help you how to help your friend unfortunately this is something really not easy to handle, because to tell a person, oh, you have a problem, people get offended, right? So perhaps maybe you need to say, I'm going to a counseling session, do you want to follow me? Then, or go yourself and talk to a counselor, find a way how to help your friend. Yeah.
I think yes. Maybe sometimes, your friend, they feel shame to go to see the counselor. What you can do, what you can help is to go together. So that she feels that she has someone that care about her. So even though you cannot do so much, but just be there for her. I think that's maybe a good step, the first step that you can take it, Atika. All right. Okay, about the video presentation for today and previous presentation, if you miss, you have to give us a few days, maybe next week or early end of this week, that we will upload it all the presentation, because we have to do some editing. We are using the same link, all the videos are merged together. So you can check out in our website, IS website. So we will put based on the topics, and you can go through to the link and have a look at the presentation. If you missed previous presentation, or if you missed the beginning of this presentation, okay? So all video will be available. Just give us time to do the editing. All right. Thank you so much, Prof. Nasrin, for your time. And thank you everyone for your attendance today. Don't forget to fill out the comments form. So tomorrow we have also about a talk about time management for doctoral students. Okay, and in the afternoon we're going to have a talk from Professor Siti, who will talk about how you